So today we're going to talk about dental x-rays, which we always take with every dentistry at Woof and Purr Vet, and the importance that they have for us in guiding how we treat, what we want to prevent, the medications we send home, in addition to the procedure that we perform initially. Our first x-ray is of a senior citizen, a little Yorkie. Yorkies frequently have the problem that we see in this video. And what we see here is a dilacerated, which is hooked tooth. This tooth is not in need of removal, which is great news, because if it ever was, we would have to literally drill down into this jawbone, this mandible, to clear the way for this hooked root to come out. The second problem that we have with this tooth is look how close it is to the under edge of this little girl's jawbone. This jawbone is going to be very fragile, and if we ever needed to remove this tooth, we'd have to be exquisitely careful to make sure and preserve the health and intact nature of this jaw. So good news for Sophia. She kept that tooth for that day, and she's doing well. Our next x-ray. This is a cat, senior citizen cat, who had a number of problems in her mouth, but the first one I want to show you on this x-ray is this little tooth right here. We thought, looking at her mouth, that this tooth was gone, that tooth, moved on, that it fell out entirely. What really happened is the tooth fractured. The crown of the tooth came off, and the tip of the tooth is gone, but the root remains. That is extremely painful, something that we need to get in there, open up and remove, flush it out, close it up, so this cat can be free of pain and this tooth does not jeopardize this lower jaw any further. The interesting thing on this x-ray is her canine. This canine tooth, like all teeth, is supposed to have a little black line, a little black outline around it. That line is the ligamentous space where we actually place the elevator when we're going to remove the tooth. This line is gone because the body has started resorbing this tooth. It has taken that space and turned it into bone. So if we tried to go into this tooth, we'd get in about this far, and then there would be no space, and we would be at risk of breaking this tooth off or breaking her lower jaw while we were trying to remove this tooth. That's very important information to have before you start trying to remove the tooth. This next x-ray is also the same cat. Here you can see this tooth has been resorbed. The body has removed nearly all of this beautiful black line you can see, which is that space we drop in with our elevators. It started eating the back of this tooth, but most importantly, it has taken the top, almost the entire crown off this tooth, and the ligament space that we can see here on the tooth beside it is nearly completely gone in this tooth. There is a non-vital tooth. This tooth, it would be very much at risk of actually fracturing the jaw, fracturing this tooth, and what needed to happen was a crown amputation where we just take the top of this tooth off, because that's not going to be painful. We also need to take this little lip off here, flatten it out, flush it out, and sew it closed. That's the best thing that we can do with that tooth. This next picture is also the same cat. She previously had an abscess here at the top of her left side of her mouth. This tooth is long gone. Without x-rays, we would never have known there was a huge, pokey, pointy piece of her maxilla that if we sewed over it would cause her constant pain by poking from the inside of her gingiva. Because we were able to see on x-ray that all this bone was gone, we were able to open it up and smooth down this bony surface so we could sew it smooth, flat, closed, and prevent her from having pain. Our next x-ray is a geriatric Jack Russell Terrier. Now, of course, this tooth needs to go. This dog was so painful that we couldn't barely look at his mouth while he was awake. Under anesthesia, we take a look at this tooth and we know it has to go. A lot of vets would tell you they didn't need x-rays to tell you this tooth needed to go, and we definitely took this tooth out. What we didn't know and would need x-rays to know is this tiny little tooth right behind this huge important canine that had fractured off. The root was retained. The body was trying its best to wall it off, but that is a nidus that can allow an abscess that's constantly painful. We opened it up, We took out this little retained root, we flushed it out, we sewed it up, and we really increased the comfort level for this little 16-year-old Jack Russell. We made him a lot more comfortable. This next tooth is also Rocky's. Rocky had what we call an oro-nasal fistula. An oro-nasal fistula communicates from the tooth through the roof of the mouth up to the nose, and Rocky actually had discharge, green pus coming out of his nose from this tooth. We could probe under anesthesia, which we never could or would want to do awake, and probe all the way up into his nasal cavity. This tooth needed to come out, but we needed to be extremely careful when we took it out because this bone is obviously so thin and so diseased. Because of this tooth, especially, Rocky went on long-term antibiotics to help get this infection under control. After we flushed it, smoothed it down, and sutured it, we want this to heal up and his maxilla to be as pain-free and as strong as it can be over time. Here's another picture of Rocky. Here's another new tooth that needs to come out, but most importantly, it is also very dangerously close to a very large tooth. There's also a pokey little bone spur right behind it. So certainly we needed to know that all these teeth needed to come out, but mostly importantly, this spur tells us we need to smooth that down, and this tooth, we need to be very careful of that canine tooth. Going forward with Rocky, one more picture of him. This is his upper right incisor, his upper little tooth in the very front. The rule in veterinary medicine is if you don't have 50% of the bone, the tooth needs to go. 50% of the bone that should be covering up to the crown. The crown is where you can see this bright white line, the enamel comes. So obviously this tooth should have about at least 50% bone coverage. This tooth should have about 50% bone coverage. We don't have that. Not only are these teeth loose and wiggly, these teeth are painful. They also predispose him to abscesses, which are infections that can further damage his face. So these teeth also needed to go. Last x-ray I'm going to show you is a little Chihuahua. This Chihuahua also had end-stage dental disease, and certainly we can tell here that of his 6 little incisors, 3 are gone. What we didn't know is 2 of the bigger ones had already abscessed, and we were working in a very delicate mouth. We needed to flush that really good. He also needed to go on long-term antibiotics. And most importantly, this tooth was already dead and non-vital. You can see how bright white these are with a small little root canal that holds the nerve and the vessel. This tooth has a very wide canal. Because it's dead, it is prone to infection, and it's terribly painful. So I'm really happy we were able to take all of these teeth out, flush it out, close it up, place him on pain meds and antibiotics, and after he healed, this dog's gonna be much more comfortable. Thanks for listening, and I hope I've helped you learn about the importance of dental x-rays every time for every pet in veterinary medicine, especially here at Woof and Purr.